Hello, my name is Melissa Sams, and I will be presenting my argument as to why incorporating the eHealth exchange and the future requirements of state operational plans should be considered. Um, Incorporating the eHealth exchange into future state operational plans would offer several benefits to established infrastructure, national reach, and standardized protocols as it facilitates and secures reliable health information exchange across state lines, simplifies quality measure reporting, improves care coordination, and promotes health equity. So in my first point, I would like to mention that including eHealth exchange um, into future operational plans would allow provider to provider exchange across state lines in this network of networks idea. So that would be the eHealth exchange connects state and regional health information exchanges, major hospital systems, and federal agencies, creating a hub and spoke model that minimizes the need for costly point-to-point connections. This would also support trust within the healthcare field and within patients as participation is based on a single legal agreement. Reducing the administration burden and cost of establishing a one-off data sharing agreements between disparate entities. And then for the patients who travel or receive care across state borders, the network would enable the providers to receive critical health summaries and ensure the continuity of care for those patients. A single connection to the eHealthcare exchange provides access to the nation's largest health data network, simplifying the interoperability strategy for providers and state plans, which then would reduce the burden of administrative team members. Next, quality reporting measures to Medicare quality improvement organizations and health plans can be incorporated using the eHealth exchange into state operational plans that can standardize and improve the efficiency of quality reporting. The eHealth exchange network includes rigorous content validation, ensuring that quality reporting is based on standardized, interoperable, and usable data. This would likely enhance the credibility and timeliness of the data received by the quality improvement organizations, which is a key concern for quality directors. The eHealth Exchange is the only national health data network with federal agency participants that includes the Center for Medicare and Medicaid Services, and this can facilitate and automate the submission of quality measures to quality improvement organizations and other federal entities. And then exchanges within the infrastructure that include the fast healthcare interoperability resources, so the FHIR standards, can help automate prior authorizations, reduce administrative burden, and support value-based care determinants for health plans. Lastly, improving the eHealth exchange can help address health disparities and improve healthcare equity, care coordination, and improve better patient outcomes by making comprehensive patient data more accessible to providers. The eHealth exchange could also improve care coordination for vulnerable populations such as underserved and marginalized populations as they often receive just disjointed care due to the lack of data sharing between different providers and care settings. The use of a national network ensures all providers have access to the same patient data, which reduces duplicated services and errors. The network's connectivity with public health agencies across the country allow for timely data sharing, helping to identify and respond to health concerns and allocate resources more effectively in high-need communities, which all enhances public health surveillance. Participation in the eHealth exchange ensures connectivity with agencies like the Indian Health Service and Veterans Health Administration, which are critical for coordinating care for underserved and specific federal populations. Potential challenges related to utilizing eHealth exchange uh, includes cost, sustainability, and resources. The lack of financial and technological resources, which are the primary reasons preventing small and rural providers from participating in electronic exchanges. Therefore, due to the lack of financial and technical resources such as adequate IT staff and sufficient access to broadband internet, providers are unlikely to participate in electronic exchanges. Therefore, due to the lack of financial and technical resources such as adequate IT staff and sufficient access to broadband internet, providers are unlikely to participate in electronic exchange. Long-term funding has also remained a concern for health information exchange efforts, raising questions about financial stability over time. Financial burden on smaller providers. While the network offers a cost-effective national solution, the financial and technical burden for smaller practices to participate and integrate their systems could still be prohibitive, which could worsen rather than improve equity if a state plan relies too heavily on the eHealth exchange without additional funding mechanisms. So in summary, although challenges such as implementation costs and data completeness remain, using the established network can improve care coordination and support health equity, including the eHealth exchange and state plans is a great way to use existing systems for sharing health information nationwide. To mitigate potential drawbacks, states should ensure their operational plans incorporate support for small providers who may struggle with the costs of participation, educate clinicians on how to effectively integrate and interpret HIE data, provide robust technical support to maximize the value of the exchange. And then finally, the integration of eHealth Exchange aligns with the goals of modern healthcare to provide better, more efficient, and more equitable care through reliable and secure data sharing, and future exchange requirements should include the use of eHealth exchanges. And then here is my references.